Dengue is a viral infection transmitted by mosquitoes. It is common in tropical and subtropical regions around the world. The disease can cause a range of symptoms, from mild to severe. Early recognition and management are crucial to avoid complications. This essay will detail the symptoms of dengue and what actions to take if they occur. Understanding the symptoms is important for everyone. It helps in early detection and timely treatment. Let us dive into the various signs and symptoms of this disease. Early detection can significantly improve the outcome for those affected. Recognizing the symptoms is the first step. The initial symptoms of dengue are often mistaken for the flu. This is because they share many common features, making it difficult to distinguish between the two without proper medical testing. They include fever, headache, and muscle pain. These symptoms can vary in intensity, but they are usually quite severe and can significantly impact daily life. Fever is usually the first sign of dengue. It can be very high and come on suddenly, often reaching up to 104 degrees Fahrenheit or higher. This fever is often accompanied by chills and sweating. The chills can make the person feel extremely cold, while the sweating can lead to dehydration if not managed properly. Headaches in dengue can be severe. They are often described as intense pain behind the eyes, which can be throbbing and persistent. This can make it difficult to concentrate or perform daily tasks. The pain can be so debilitating that it interferes with work, school, and other responsibilities. Muscle pain, sometimes referred to as breakbone fever, is also common. This term highlights the extreme discomfort and aching that can feel like the bones themselves are breaking. It affects the muscles and joints, causing significant discomfort. The pain can be widespread, affecting various parts of the body, and can last for several days. These symptoms can appear 4 to 10 days after being bitten by an infected mosquito. The delay in symptom onset can make it challenging to identify the source of the infection. They are the body's initial response to the viral infection. Recognizing these early symptoms is crucial for seeking timely medical attention and managing the disease effectively. Fever is the hallmark symptom of dengue. It typically starts suddenly and can reach up to 104 degrees Fahrenheit or 40 degrees Celsius. This high fever can last from 2 to 7 days. It is often accompanied by a feeling of overall weakness and fatigue. The fever in dengue can fluctuate. One may feel relatively better for a few hours, only for the fever to spike again. It is important not to ignore a high fever. Monitoring body temperature and staying hydrated are essential. If the fever persists or worsens, medical attention should be sought. Early intervention can help manage the fever and prevent other complications. Headaches in dengue are not like typical headaches. They are usually more severe and persistent. The pain is often centered behind the eyes. This retroorbital pain can be extremely uncomfortable and debilitating. These headaches can make light sensitivity worse. Patients may find it difficult to be in bright environments. Rest and hydration can help alleviate headache symptoms. Over-the-counter pain relievers should be used cautiously and under medical advice. Persistent headaches should not be ignored. They can be indicative of the body's struggle to fight the virus. Section 5. Muscle pain. A common complaint. Muscle pain in dengue is widespread. It can affect any part of the body, making movement painful. This pain is often described as severe and aching. It can feel like the muscles are being squeezed or pulled. Joint pain, particularly in the knees and elbows, is also common. This can make bending and extending these joints very painful. Rest is crucial for those experiencing muscle pain. Gentle stretching and hydration can also provide some relief. Muscle pain can last throughout the duration of the fever. It typically improves as the fever subsides, but may linger for a few days after. Section 6. Serious symptoms: bleeding, rash, and severe abdominal pain. These symptoms are indicative of the disease progressing to a more critical stage. As dengue progresses, more serious symptoms can develop. This is a crucial phase where the patient needs to be closely monitored. These include bleeding, rash, and severe abdominal pain. The rash often appears as red spots or patches on the skin, which can be quite alarming. Bleeding can occur from the nose, gums, or under the skin. This type of bleeding is a clear sign that the disease is affecting the blood vessels. This can be a sign of severe dengue or dengue hemorrhagic fever. Immediate medical intervention is crucial at this stage to prevent further complications. A rash may also develop. This rash can be itchy and uncomfortable, adding to the patient's distress. It can appear as red spots or patches on the skin. The appearance of the rash can vary from person to person. This rash can be itchy and uncomfortable. It often leads to scratching, which can cause further skin irritation. Severe abdominal pain is another serious symptom. This pain can be intense and debilitating, making it difficult for the patient to carry out daily activities. It may be accompanied by nausea or vomiting. These gastrointestinal symptoms can further weaken the patient. This pain can indicate complications such as organ involvement. The liver and other organs can be affected, leading to more severe health issues. These serious symptoms require immediate medical attention. Delaying treatment can result in life-threatening complications. They can indicate a progression to a more severe form of the disease. Early detection and prompt treatment are essential to manage these symptoms effectively. Section 7. Understanding bleeding and its risks. Bleeding is a critical symptom in dengue. It can range from mild to severe and indicates a serious complication. Nosebleeds and bleeding gums are common signs. They usually occur due to a decrease in platelets, which help with blood clotting. Bleeding under the skin can look like bruising or tiny red spots. This is a sign that blood vessels are leaking. In severe cases, internal bleeding can occur. This includes bleeding in the stomach, which can be life-threatening. Anyone experiencing unexplained bleeding should seek medical care immediately. Monitoring platelet levels is crucial in managing this symptom. Section 8. Rash, identifying skin changes. A rash is a common symptom in dengue. It is one of the key indicators that can help in the early identification of the disease. It can appear as small red spots or larger patches on the skin. These spots are often bright red and can vary in size and shape. This rash usually starts a few days after the fever begins. Initially, it might be faint, but it can become more pronounced as the days go by. It often appears on the chest, back, and limbs. These areas are commonly affected, but the rash can spread to other parts of the body as well. The rash can be itchy and uncomfortable. This itching can sometimes be intense, leading to further irritation of the skin. It may also cause the skin to feel warm to the touch. This warmth is due to the body's immune response to the virus. While the rash itself is not dangerous, it is a sign that the body is fighting the virus. The immune system is actively working to combat the dengue infection. It is important to monitor for other symptoms alongside the rash. Symptoms such as high fever, severe headache, pain behind the eyes, joint and muscle pain, and fatigue should be closely observed. If the rash is accompanied by other severe symptoms, medical attention is needed. Severe symptoms can include bleeding, persistent vomiting, and difficulty breathing. The presence of a rash can help doctors diagnose dengue. It is one of the clinical signs that, along with other symptoms and laboratory tests, can confirm the diagnosis of dengue fever. Section 9. Severe abdominal pain. Recognizing the danger. Severe abdominal pain is a serious symptom of dengue. It often indicates a progression to dengue hemorrhagic fever or dengue shock syndrome. This pain can be intense and persistent. It is usually located in the lower abdomen and may be accompanied by vomiting. Abdominal pain in dengue can be a sign of internal bleeding or organ involvement. It is crucial to seek medical care if this symptom occurs. Ignoring severe abdominal pain can lead to serious complications. Timely intervention is key to managing this symptom effectively. Patients experiencing severe abdominal pain should be closely monitored. Medical professionals can provide the necessary care to manage this symptom. Section 10. The importance of early detection. Early detection of dengue is essential. It can greatly improve the chances of a full recovery. Recognizing the initial symptoms can lead to quicker medical intervention. This helps in managing the disease before it progresses to a severe stage. Blood tests can confirm a dengue diagnosis. These tests check for the presence of the virus and the level of platelets in the blood. Preventive measures such as avoiding mosquito bites are also important. Using mosquito repellent and wearing protective clothing can reduce the risk of infection. Early detection and prompt treatment can prevent serious complications. It is important to be vigilant and aware of the symptoms. Section 11. Conclusion. What to do if symptoms occur. If someone experiences symptoms of dengue, they should seek medical help immediately. Early diagnosis and treatment can prevent severe complications. Rest and hydration are crucial for recovery. Over-the-counter medications for pain and fever can be used, but always under medical advice. Avoid self-medicating with non-prescribed drugs, as some can worsen the condition. Doctors can provide appropriate treatment and monitoring. Preventive measures such as avoiding mosquito bites are also important. Take steps to protect yourself and others from mosquito exposure. In conclusion, recognizing the symptoms of dengue and seeking timely medical help can save lives. Stay informed and take preventive measures to reduce the risk of infection.